In the immediate care of the newborn at birth, there are some of the sequence of the steps which we should follow at the clinical site. So first, I'm discussing them step by step. First, the baby which is to be delivered should be delivered on a pre-warmed dry towel. Why it should be delivered on a pre-warmed पहले से हीट किया हुआ dry towel, why it should be delivered onto that? So to prevent hypothermia is a major risk factor for a newborn baby that may even lead to death of the baby. Then second is maintain a patent airway so that baby can breathe well and that can be determined by proper positioning. Right lateral and suctioning may be required if there is are secretions obstructing the airway. Then third is calling out the time of the birth, sex of the baby, and showing the baby to the mother. Then and placing the baby onto the abdomen of the mother. Then assessment of the newborn. In three forms the assessment can be done: whether the baby is term, whether the baby is crying, whether the baby is having a good muscle tone. Then next comes is the care of the eye. From inner canthus to outer canthus, the eye should be cleaned. After that, cord should be clamped after 1 to 3 minutes and 2 to 3 centimeter away from the umbilical cord. After that, the skin care should be maintained, and in the babies the clotting factors are not there, so there may be bleeding abnormalities. So in that case, vitamin K injection should be administered into the thigh till the in the vastus lateralis muscle. And if the baby is term baby, then 1 milligram of the vitamin K should be injected. If the baby is preterm, then 0.5 milligram of the vitamin K should be injected. And as the baby is not having any name, the baby should be identified by the parents. The name is not available, so father or mother's name should be included. Then the time of birth, sex of birth, and the fingerprint should be taken of the baby so that the baby can be easily identified among so many newborn babies and the baby is not lost. Then the baby's head should be covered with a cap, again to prevent hypothermia. And then by determining all these things, we will determine whether the baby needs some better level of care or can be or is a stable baby. Thank you for listening.